Okay, everyone. Thank you for taking time to join us today. Really appreciate everybody who's taken time to participate in the call, not only as a panelist, but as a participant. One of the things that we'll say at the end, but that we do want to ask everybody who is able to participate on the call or listen to the call today, that you would take the information that you learned today and share that in your circles, whether that circle be in your work setting, in your church setting, in your family setting, any of those social circles that you run in. Hopefully you'll pick up some good information today that you can share with other people. We had done a number of these town halls over the last several months. It's been since July since we did our last one. What we have seen is a recent uptick in numbers of COVID. So we want to make sure that our community is aware of steps we can take to try to reduce those numbers and some best practices. We are waiting for Two Rivers to join us, but we do want to be respectful of everybody's time. So we are going to jump into some questions for Dr. Shackleton. So Dr. Shackleton, thank you for being with us today. If you could just share with us a little bit about the insights that you've been seeing locally as it would pertain to COVID. What are you noticing? What are you seeing? Is it real?
Oh, it's real, and it's getting worse. Will, if you can bring up the first slide. This is an indication of where we are at today. And we've been tracking this over the last several months. The red line on the top one is when we started getting the rapid test. And you can see how the number of tests we did had rapidly accelerated over the last several weeks. Those first 2% positives spikes are really high because we really weren't doing a whole lot of tests at that time. But if you look at that, the two graphs together, we're doing more tests, but the trend has been that we're getting more and more positives in the community. It doesn't look like a whole lot when you're looking at it on a day-to-day basis, but when you look at the trend, we really are increasing. And we're running about anywhere from an 8 to 12% positivity rate. Now, granted, not all of these patients are Gothenburg residents, but on the same token, some of Gothenburg residents get tested out of town. So we think this is a fairly good depiction of how many we're actually seeing.
Great, thanks, Carol. And yeah, the reason last time we had a town hall was back in July, as we were seeing those numbers increase, and graphically, it's very easy to see why we're having another call today, or another conversation today. It may seem like old information, but I know every once in a while I need a reminder on what some of our best practices are. What can I be doing to help slow the spread of COVID?
The same old, same old, same old. You need to wear a mask. You need to stay 6 feet apart, whether it's inside or outside. It really doesn't make a lot of difference if there's not wind blowing. You need to stay 6 feet apart. You need to not be touching your face and your eyes and so forth. And you need to protect your neighbors. I mean, you're wearing a mask not so much to keep from getting it yourself, although it does help. But if you are one of those asymptomatic carriers and have no clue at all that you are an asymptomatic carrier, you have a strong possibility of spreading that to someone else. And so, out of respect for your neighbors, please, please wear a mask, do the 6 foot distancing, and wash your hands, don't touch your face, all of those same things we've been preaching for 6 months.
Dr. Shackleton, I'm not in the medical community, but I'm aware of a couple of cases where people have been tested for antibodies in their blood and found out that they did have COVID at some point in time, or that they had the antibodies present and they were completely asymptomatic. Are you seeing instances of that in the medical community?
We're seeing a few, but not as many as you would expect. There was a lot of people that thought they got COVID in January. Almost all of those people came up with negative testing. But that's just another indication that people can be completely asymptomatic and spread it to their neighbors, because we've seen the antibodies then show up later.
Yep, good. So a couple of questions that we had come in from the queue. If somebody gets tested positive or is displaying symptoms, what's the protocol for when they return to a public setting, or what is that sequence of events?
Okay, from the onset of symptoms or the positive test, whichever is first, we want people to quarantine for at least 10 days at home. And we need to have people be at least 24 hours without a fever, not using any Tylenol or ibuprofen, and showing improvement in all of their symptoms before they come back to work. But we really need to give it that 10 days. And after that, if they've had 24 hours without a fever and all of their symptoms are improving, then they can come back. 14 days is better if you can make it that long. And actually the hospitalized patients were saying 20.
Yeah, great. What are you seeing the impacts of the disease based on age? It seems like it's almost two different diseases in some ways, depending on people's outcomes based on their age. Can you illuminate any of those facts for us?
Yeah, DHHS has some wonderful graphics on that. Will, if you bring up slide 2. What we're seeing is that the younger kids tend to get it more often, or, we have more positive cases. That 20 to 34-year-old who are indestructible and have little kids and they're out with their neighbors and so forth, they seem to have the highest. But look, yes, we'll go to the next one. Look at the increase as terms of the percentage that are hospitalized as we get older. And you can see on the left-hand side of that there's that daily active hospitalizations that has spiked in October. And most of these people, 2/3 of them, are in the over 55 year age category. And if you go to the third slide, 91% of the people that die are in the over 51% category, over 55% age category. So 23% of the cases make up 67% of the hospitalizations and 91% of the deaths. Protect your neighbors, protect your aunts and uncles, grandparents, parents, church family, co-workers. There's a lot of us out there that are over 55, and I'm not going to tell you how old I am, but a lot of us are out there that really are at risk, just based on age, not to mention all the other comorbidities that come with age, like diabetes, obesity, high blood pressure, heart disease, lung problems, kidney problems. All of those things put people at higher risk.
Dr. Shackleton. Oh yeah, go ahead. Go ahead, sorry.
Next slide. And based on that increase of hospitalizations, we're seeing a decrease in the amount of bed availability. We're starting to see difficulty in transferring patients. Currently, we have 7 patients in the hospital, and we're starting to have difficulty in transferring people out when we need to, because they're just, Kearney Regional, Great Plains, Good Sam, UNMC, they're all starting to max out their capacity to take certain patients. So that is becoming a problem. Will, next slide. And here's what the projections are if we don't pay attention to the masking, the social distancing, and all of those things. The bottom green line is if we had universal masking. And you can see how that keeps that curve flat, and it doesn't make things any worse than it would be otherwise. The middle line is if we continue in our current habits, which is that some people really don't think there's anything out there, and they don't abide by the masking and the distancing, but a certain percentage do. And if we all just say, we're tired of this, we don't want it, we got mask fatigue, look at what happens to not only our incidence of cases, but our death rate. It just skyrockets. So it's important to do all of those basic things and to continue to do them, until we have herd immunity or a vaccine or some other way of, getting this under control. And speaking of vaccines, we're getting closer, but it's still a ways off. There are a number of vaccines that are in trials. The phase 1 trial is just testing the dosage. The phase 2, they start putting it out to a limited number of people to see what some of the side effects are. Phase 3, large scale tests to see if it actually works. But there's only 5 that have been approved for early or limited use, and those are all in Russia and China. And I don't know about you, but I'm not too certain I want a vaccine from China just yet. Then the FDA doesn't have anything approved yet. There are a couple vaccines in the States that have been accelerated to phase 3, and I'm hoping to see that happen in early 2021, but I'm thinking it's probably going to be closer to, late spring or summer. And as you can see at the bottom of that, get your flu shot. The symptoms are very similar, and you don't want to have them both at the same time because that could be really devastating. The symptoms for flu, tend to be a little less intense. The COVID symptoms, people get the fatigue and they're just knocked flat. And sometimes it takes them, literally weeks to recover, and they have heart problems and blood clots and persistent lung problems, even more so than what people have with influenza. So get your flu shot. You don't want to have your immune system at risk to get the coronavirus just because you didn't think you'd get the flu this year.
Great. Well, thank you, Dr. Shackleton. When is the right time to be getting a flu vaccine?
Now.
Good.
The flu vaccines are out. The high dose vaccine is recommended for particularly elderly with comorbidities. But if you don't have the vaccine, the high dose vaccine isn't available for some reason because they tend to run out quickly, get the regular one or get the boosted one. You got to have the flu vaccine.
Yep. Where can somebody get vaccinated?
The pharmacy, our facility, Walmart. There's
anywhere.
Several places. I mean, there's a lot of places, and I know our nurses sometimes will go to the various businesses, but the most common places here in town are the pharmacy and us.
Yep. And oftentimes, if somebody has any type of insurance, that vaccine's going to be covered at virtually no charge,
Right.
Which makes sense for the insurance companies. If somebody's taken a precautionary measure to maintain health, they're going to cover that expense for somebody. So that in and of itself, if you're getting something free from the insurance company to help you stay a little bit more healthy, that's probably an activity you want to engage in. Right. So, yeah.
Go figure. Free from the insurance company is unusual. You might as well take advantage.
That's right. So, yeah. Thank you, Dr. Shackleton. Appreciate it. We're going to transition now to Two Rivers. Katie, if you could do us the favor of introducing the rest of your team. I think many of the participants today are going to be new to the town hall setting. So if you could introduce us to the rest of your team at Two Rivers.
Sorry, we were just a little behind today. I brought friends, which complicated matters. So I'm sitting next to Chris Fankhauser. She's our Healthcare Coalition Coordinator and actually works with a bigger district than Two Rivers, but she works at the Two Rivers office. And then we have Dr. Menon here with us. He's our epidemiologist. He's going to show us, he's always in the weeds and looking at stats, and he brought us some specific Gothenburg statistics that you'll be able to share, and we sent them to Will, which will be helpful. And we're going to let Dr. Menon take the lead for today, but we're going to fill in if you have general questions for us.
Great. Well, thank you. And thank you, Dr. Menon, for taking time to be with us today. As far as Gothenburg goes, can you give us some insight to how our numbers are looking specifically in the Gothenburg community?
Perfect. Nate, can you hear me?
Yep.
Awesome. Thank you so much for this opportunity, and thank you for conducting this call. I'll get right into it. There's a document that I think Katie had sent out. I don't know if it's if you have it, and if you do, we can pull it up just so that everyone has a point of reference. Yeah, perfect. Awesome. So as you can see, this is just sort of like a rolling average, a 7-day rolling average of 3 major urban centers in Dawson County. The bottom blue is Cozad, the middle orange is Gothenburg, is Lexington, and then the gray on top is Gothenburg. And this is from a period of July 1st to the 12th, to the 11th of October, just a couple of days back. So the idea was to just sort of like show how this has moved over time, to talk about Gothenburg with respect to both Lexington and to Cozad, because we're beginning to see that even within rural areas, we think that incidence rates might have similar levels of risk, if not similar rates, but similar levels of risk when you compare urban centers. It just makes sense that people are packed together and have more interpersonal contact and maybe indoor contact, which is unmasked or does not have much social distancing. So what we can see is that sometime around maybe July, August, we had that small spike of cases, and that was mostly driven. We had a spike of cases in Gothenburg, and then following that, we've been seeing a slightly gradual, slightly more gradual, but slightly more sustained increase in cases over the last maybe 4 weeks or so. We're still talking very small numbers. Overall, as you can see, the positivity rates is about under 8%. It's about a total of about 83 or so positives, about from about 1,100 or so total tests that have been done since July 1st. So that's about 3.5 months. And the reason for using this as our time period was because the directive health measures changed around the 1st of July. It was a holiday weekend and sort of the official beginning of summer and so forth. And so there is good reason to believe that the public's behavior would have perhaps changed to some degree as compared to the sort of more stringent quarantining and social distancing that was observed before the 1st of July. So this is sort of the table breakup of all of the cases. The same thing, essentially, it's the positives and the total cases that have been presented in the it's for the same time period that was present in the previous graph, but this is week by week, looks at it by age categories. And so the idea for this is to sort of group all of the kids, the preschoolers in one category, 0 to 4, all of the people in school from 5 to 17, and then all of the sort of quote unquote working age people into 2 sort of broad categories, and then the 65 plus, and to group them together. The idea is to try and look at people with different risk profiles. And it's imperfect, but it's the best we've got for overall statistics. And you can see that the numbers are overall small. What I've highlighted in yellow are if any of the individual cells are over the number 4, then they've been highlighted in yellow. Positive cases have been highlighted in yellow, and then in the totals on the right, you can see if anything is over 9, then they've been highlighted again in yellow. And you can see that there isn't really too many cases. That overall, that only a total of 82 out of 1,031 tests. But I think if we were to look at broad trends, it would be that older age groups and that it seems to be that older age groups seem to be seeing lesser cases now than earlier when we had the spike. And the spike is nowhere near as big as it was back in July, August. But Gothenburg's looking pretty good. I think that the efforts of all of the institutions, including the school and the city, have clearly have worked. So I think that this is really good feedback, and this is just a good overview of the last 3.5 months. Thank you.
Yeah. Dr. Menon, what would you attribute this most recent spike that we're seeing? Can you give us any insights to what the spike we're currently seeing may be attributed to?
So I think I can comment about what I don't think it's attributable to, and I don't think this is necessarily like a community, like a super spreader event or like one event that's sort of led to multiple cases, which is sort of the pattern we have seen in some other towns, not necessarily in Dawson County, but in Buffalo County. I do think that again. We are seeing a total of 9 new cases in a week, which, for a weekly rate, it's quite a lot. It's a big jump from an overall average, but I don't know that. Although the rate of growth is great, I don't know that this would qualify for a spike. I would think that what we saw in July, August would probably be closer to a spike. The shift was more than 2 SD. Here, the shift is not as much from previous. I think that what we're seeing actually is a little bit more of a gradual increase in detected cases. And this is important because one of the realities of Gothenburg also is that you have to either be really sick or motivated through employment to actively go out and seek testing. It might involve you to have to travel a longer distance and so forth. And so what this might reflect actually is that more people might be having symptomatic illness, and for some reason more people are getting tested. That's a very clear trend. We can see that the overall number of tests have really increased over the last 4-5 odd weeks. So more people are getting tested. The question is why, and it's possible that they are probably more symptomatic cases. Wait and watch is what I would say. But short answer, I don't think we're necessarily in the spike, probably in the beginning of a spike, but not necessarily in the middle of a spike. Thank you.
Great. If you apply that logic to symptoms and seeking resolution, how do you think that will walk the path with the typical flu season that we're going to be likely entering into, and what calendar date typically signals the beginning of flu season? Not that it's that precise, but how close are we to getting into flu season?
I think to echo Dr. Shackleton's words before this, I think we are in for flu season. I think that, as fall moves on, we are obviously, as I know in Two Rivers, we've already started vaccination programs in the schools, as well as, we have also immunized all of our staff. For what it's worth, and I know that Katie has some good information about this, and she will be able to share with us after I'm done. But we do know that overall flu numbers have been lower in the southern hemisphere, in countries that usually register a higher flu rate. Argentina and Australia are a good example. We don't really know the reason, but it's possible to hypothesize that reduced, increased social distancing and masking has perhaps got some sort of a protective effect towards transmission of the flu also. Having said that, it's also conceivable that people might be more motivated to take the vaccine this year. It's just been a year when we've talked about issues like this a lot more. I would not be surprised to see just overall uptake rates being higher among the population, which is obviously a really good thing because herd immunity does play into this within the flu particularly. So
great. Thank you. Switching gears, just would like your insights on DHMs, directed health measures. Are they consistent throughout the state, or do they vary by region? And what's the disconnect between DHMs and what would likely be best practices?
If I could hand this over to Katie and to Chris, I think they are subject experts in this, so I defer to their expertise.
Sounds good. Thank you. Katie and Chris.
Thank you. We love talking directed health measures. It's all we do every day, all day. It's the best. So directed health measures as of right now are consistent across the state. And they're much more to the point, concise than they were before. The really big regulations that we are seeing that are affecting more people are actually part of the quarantine and isolation directions. And there is a little room for, I don't know, for understanding because of the wording in the directed health measures. We've been working closely with the schools because they're the people that the new wording affects most. And I definitely have had late night phone calls with both Dr. Rhodes and the school nurse, and we've talked through it. I know the school's working really hard to follow them. And we're happy to share directed health measures with anybody willing, but as of right now, there's no limits on gathering size, no limits on buffets at restaurants, anything that we had seen before. It's a lot more of things like reminders to follow best practices for business and to stay home if you're sick. And then they are bare minimum best practices. We still recommend, like Dr. Shackleton said, masks everywhere, increased hand hygiene, do as much as you can to stop the spread of COVID.
Great. Katie, one of the things as I was even preparing for this meeting, just trying to get my mind wrapped around DHMs, and just because it's allowed, does that mean it's appropriate? And in my mind, or to try to help me understand it, I started thinking about the legal age to purchase alcohol or tobacco or consume alcohol. It's absolutely legal for me at 21 to go purchase alcohol and consume it. Does that mean that I do that all day, every day? And is there a parallel to the DHMs? And these are all so new for all of us. I'm trying to find parallels in our lives that you can apply these to. Just because it's okay doesn't mean it's appropriate. Does that make sense?
Right. It's perfect. That's exactly what I would say. We're trying to walk that same line that you mentioned, and we don't want to cancel events. We don't want people to have to cancel Halloween and stop celebrating with each other, but we do definitely want people to take more serious precautions than they would have ever taken before. And so we're thinking about things like today is the first day of Carney Cruise Night and Carney Cruise Week. And although they didn't cancel the event, they are requiring face masks at all of the Carney Cruise events to be safer for the public. We did though. If you feel comfortable canceling an event, we will always stand behind you and help you take that flack. We're here to take any heat off of anyone else right now for being safe, and we always will.
And I think that's what our public and hopefully the participants in the call today are trying to develop is what is appropriate behavior in different settings. And we're all trying to navigate what are the social norms. When do I absolutely have to have the mask on? When is it okay not to? No different than consuming alcohol or smoking. Both those you just absolutely don't do on school property. Same with wearing a mask. You absolutely wear a mask on school property. That's been our mandate and the policy. And where it gets more awkward is in an office setting. Do you drink at the office? Well, maybe some days, but the mask. And in those public settings, when is it appropriate? When is it not appropriate? And knowing that we're developing those social norms aren't in place right now. We're trying to figure it out. And it helps me if I think about it that we're going to get to some level of self-control where we impose those things ourselves, and we know what's right, we know what's appropriate, we know what's respectful of the neighbor, and we know what's respectful of the community, even though we would technically, by the directed health measures or by ordinances, be allowed to do something different. Did have a question just come through the queue. With a mask mandate, who has the power to enforce or apply a mask mandate? Would you guys at Two Rivers have an appropriate response on that?
So that is also a discussion that we've been having internally and externally. As of right now, our board has decided that we are not able to mandate mask usage, and it would maybe fall back on towns or counties. And from what we know politically, and it's pretty charged out there, I wouldn't fault anybody either way, but from what we know politically, most towns and counties are going to follow the example of Governor Ricketts. And right now, Governor Ricketts isn't inclined to have a mask mandate. We have seen success in cities like Omaha and Lincoln with mask mandates, and it was tough politically for the people that went through it, but it seems to have a positive effect on their COVID-19 numbers, although they still also are seeing some pretty high transmission rates. When I say positive effect on COVID numbers, I mean that their numbers went down.
Yeah. And when you talk about the political nature of this topic, it seems like some people that I have talked to have maybe tied political affiliation to an opinion on masks one way or another. It definitely seems that in the last couple weeks that pretty unified front that masks are fairly appropriate when you're in a public setting. And if at one point there was any political affiliation with the perception of masking, I think that we've certainly moved beyond that now, would be my take, which I think is good. And the one thing that's different about the mask wearing is a small piece of that does protect yourself, but the vast majority of wearing a mask is helping protect other people. And that's the education on that component. I think we could just get better and better about. I think a lot of people have the misconception that we're wearing the mask to protect ourselves, where that's actually inaccurate. We're wearing it to protect other people. For me, that makes it a little bit easier to get on board with wearing a mask. And I think we're all a little bit hungry to get back to normal, but we're all discovering what the new normal is. Our policy in the office here, if we're in the office by ourselves, we don't have to wear a mask. But when I've been in public spaces, I've had my mask on, and then I come back into the office and maybe half an hour will tick by and I would have had my mask on, and it seems very, very normal and natural. Last night, my son came home from being at school. He walked in the house and still had his mask on. It was just second nature to him. It was very natural to him. The flip side, I've also been in a setting where I didn't have my mask on. I was focused on other things. I was on task, and I was in a group of people that I felt likely would have been okay reminding me that I needed to put my mask on. We haven't reached the social norm where it's okay to say, hey, Nate, put your mask on, or at least in that setting. And I think some of those gentle reminders, I think recipients are going to be pretty okay hearing that message. We just need to destigmatize passing that message along and letting people know that maybe they have forgot to put their mask on, but we just haven't developed that social contract yet. We're working on it, and I would ask everybody on the call today to engage in that sense of community and having those interactions where we really are looking out for each other and maybe having some of those awkward conversations that just don't flow very natural to us right now, just because we haven't practiced those skills yet. So, okay, we are going to jump over to Mick. So some questions specifically about our local hospital. Jump right into a very direct question. How many ventilators do we have now in the Gothenburg hospital system?
We have one ventilator, Nate, and then we have 3 anesthesia machines that can be used as ventilators. So probably about as many beds as we can handle, we have ventilators for. So that's kind of been the same since the beginning of this. We've got the 1 vent and then the anesthesia, 3 anesthesia machines. So a total of 4 devices that we can use. And
I think at a concept level, it's really important for everybody to remember a lot of why things were closed down so abruptly this spring was all the unknowns, and we didn't want to overwhelm the healthcare infrastructure. And when we think back to what we've learned in the last 5 months, and we apply that to what we're going to learn in the next 5 months, I'm really excited where we're going to be at. All the advances that are going to take place in the coming 5 months. But the same underlying principle remains: we don't want to overrun our healthcare system. Can you give us some idea or context in our area or region, how we're doing and the capacity that we would be able to handle, and at current rates or at different trajectories, how we may be able to sustain as a medical system?
Sure. I mean, Dr. Shackleton touched on it earlier. The bigger facilities are full and we're having a hard time getting patients transferred. So Great Plains Health, Kearney Regional, Good Sam, UNMC, all of those places we are having a very hard time getting patients out if we need them out. We ourselves have been running the highest inpatient census for the last month that we have ever run, and most of those are COVID patients. Now, not a single one of those is on a ventilator. So at this point in time, my opinion is ventilators are probably not really the problem. It's just the actual number of beds. We have recently, under, I don't know which governor order it is, but as part of the emergency order, we can increase our number of bed counts. We've gone from 12 to 15 beds just to make sure that we've got capacity. We've got 7 beds allocated for COVID patients. So we've got a COVID wing with 7 beds. And then we've got 8 beds that are dedicated to, well, 2 of those are labor and delivery beds. And so that leaves us with about 6 beds for regular patients. And so, and we're running, right around seven patients, 7 to 8, pretty consistently for at least the last month. So that's typically our average daily census has been between 2 and 3. So we're seeing a lot more inpatients than we have for a really long time, for longer than I've been here.
Great.
And I think that's what the bigger hospitals are seeing as well. I don't think it's necessarily ventilator capacity as it is ICU and just pure beds. It's just these patients are taking a lot longer to get well, where as a critical access hospital, typically we'll have patients come in for 3 to 4 days. They might be staying for a couple of weeks because it just takes them that long to get well enough to go home.
So I guess to the community at large, we really would be doing a service to each other and to the hospital. The more we can be mindful of some simple precautions, wearing masks, washing hands, making good choices about our gatherings. And there really is a healthcare component. It may not specifically be the ventilators, but just the overall room availability. So yeah. I think that's not to create panic in our community. That isn't at all what your message was. But
no, not at all. And I want to also add that these patients are harder to take care of, and staffing is a real issue. Everybody has snatched up nurses and CNAs, and we have a real staffing shortage. We're trying to find nurses. I know Great Plains is trying to find nurses. I know Good Sam. All of our neighboring facilities are trying to find more nurses to take care of these patients, and those nurses are just not out there. So our nurses are working on average at least 1 to 2 shifts a week extra than what they would normally be working because of the high census we're running. So just be mindful of that too. It's beds as well as the people to take care of the patients.
Great. Mick, I know that there's been several different backup plans that have existed in the last 6 months. Can you share any insights to the current backup plan?
Yeah, it's kind of the same. I mean, if we get a patient that gets too sick that we need to get them out of here, we'll try all of our resources. Previously, we had an agreement with Kearney Regional that we would take their less sick patients and they would take our more sick patients. But I think we've kind of moved past that where they're essentially full. So a lot of our patients that we've got are actually not patients that are from Gothenburg that have come from other communities because those hospital beds were full. And so we kind of put a cap on that of how many patients from out of, that we've taken some transfers in. And we've kind of stopped that to maintain enough space for our own community. Fortunately, we haven't needed those extra beds for our own community, but that's kind of our backup plan, is to manage our beds appropriately to make sure that we have enough if we need them. But where we can send, if we were to go over that 15, we can start putting 2 people in a room. We can use our PACU pre-op, stop the elective surgeries like we did before. Those are our backup plans. They're not great plans, but that's really what our backup plans are.
Great.
Find wherever we can to stick a bed. So.
Yep. Thank you, Mick. And just another plug for the hospital. It ends up being a small world, and end up talking to friends and family across the state and across the country. For our town of Gothenburg that doesn't have a single stoplight, to have the high quality rapid test equipment that we do have in our facility, just amazing. So thank you to you and your team for providing that benefit. It's one of those things that you don't know the value of until you find yourself without it. And for people in other communities that don't have access to that tool, what a wonderful tool that's had an extreme positive impact on all of us. So kudos and thank you to the team up there for taking care of the community. Going to jump over to Dr. Rhodes and get some insights from the school perspective. One of the things that the school has done is developed a internal color code system, and would just like you to give us some insight to where we're at and how that color code system is derived.
So we use a wrist dial very, very much like the one that Two Rivers uses. And so when we look at those various risk areas, the green, the yellow, the orange, and the red, it's really predicated on what's happening regionally and maybe even more so locally. And so as Katie said earlier, somebody from the school and Two Rivers is having weekly contacts for a variety of reasons. The other thing that we do is we talk with Gothenburg Health as well. In fact, Dr. Shackleton and I had some communication yesterday just to really determine where we're at. So we really use the guidance from the medical community and from the health department to really determine where we're at. We started in the orange tier. That's currently where we're at. And our plan was developed and with the idea of multi-tiers so that we could mobilize, I think, fairly quickly and either move down if that's the direction and the communication we were getting from the medical community, or even go the other direction if we needed to.
Great. Have there been many cases at the school?
We have dealt with a very few positive cases among students and staff. We've also had a few students and staff quarantined as well because of exposure. Now the thing that is really positive, I think, around that is through the tracing that we've done with the help of Two Rivers, we have not found any positive cases where the exposure came from the school. So in those cases of positive coronavirus cases, that exposure came from outside the walls of the school system. But yeah, we have had a few, but they've been pretty small in numbers.
From an outside perspective, if you were to have told me we were going to have roughly 800 to 900 people gathering on a daily basis on one campus, and we're going to get 2 months into this with very, very limited transmission, I'm not sure I would have believed you. So kudos to you and your group at the school for putting the policies in place and the procedures that do accomplish a lot of physical distancing, the mask wearing, the hand sanitizing. It's definitely working. Keep up the good work, and I'm extremely tickled that things have gone as well as they have for you and the team at the school. How are extracurricular events going, Dr. Rhodes?
So far we knock on wood, but we have been maybe one of the rare schools that hasn't had an event or activity canceled or postponed due to the virus. We're always visiting with our opponents for that week to make sure that you know what we've maybe heard on a larger scale is specific to them, and they don't have any cases as well. So we've been really fortunate as it relates to our extracurricular activities. We're patiently waiting for some potential guidance from the Nebraska Schools Activities Association on what winter activities may look like. My assumption is that we will have winter activities, and that most likely we'll get some guidance from NSAA, but it'll probably be some local control and precautions that will be put in place at individual schools as it relates to basketball and wrestling and some of those activities.
Great. For those of us that haven't had a chance to really be involved at the school or had kids in the school system, can you give us an idea of what some of the day-to-day modifications or day-to-day in the classroom looks like?
Well, the number one precaution has been the masks. And of course, our district mandated masks right from the start of school. Quite honestly, it was a discussion that our admin team had on many occasions before we opened up our doors, and it was the best decision we made, not to have to go back and maybe mandate them later on. But you know, that's probably number one. We really try and keep our cohorts separate, particularly as it relates to Dudley Elementary and our 712 population. So we've eliminated some of the crossover that we normally might have. For instance, when our elementary kids are going to lunch and some of those different types of things. We've made some changes in the classroom. Desks are spaced out as much as they possibly can be. We do a lot in terms of disinfecting and sanitizing of classrooms, more so than we've ever done before. All our classrooms are fogged on a daily basis. All the desks are wiped down and sanitized as much as possible in between classes and some of those different types of things as well. So we've really tried to up our precautions as much as we can. Of course, we really limit visitors coming into the building. We've changed drop off. Parents will drop off items and they drop it off on a table as opposed to coming all the way through the offices. So we've tried to eliminate some of those interactions as well. And again, that's probably as much to protect them as it is to protect our student bodies as well.
Great. Well, thank you, Dr. Rhodes. Really appreciate all the extra efforts that you guys have done at the school. A question that did come in through the queue. Can you give us some ideas or insights on in-person learning versus virtual learning, and maybe why you've taken a lot of the precautions you have to try to promote and enable the in-person learning versus some of the virtual learning that our students would have experienced this spring?
Yeah, so you know, we kind of wrote the opening act last spring as it relates to this idea of remote learning or virtual learning, and we have wonderful technology and we have a lot of resources available to interact with our students. But I will tell you, as an educator, that is not the same as in-person instruction. And also, as an instructor, as a teacher, you don't have resources right there in the virtual world like you do in person. So, you know, the other thing around that is routines are very important to all people, but specifically to children. And so to have that in-person routine and have a daily schedule was really important as well to us. So we really felt that our plan needed to start with in-person instruction and to layer in those precautions as much as we could to get kids in our building for what we feel is the optimal educational experience that every student should have.
Great. then just one last question for you. It appears that the mask compliance among students and staff is extremely high. And I've got 3 different kids in the system, so I have an opportunity to go eat popcorn at the school or a school somewhere most nights of the week right now. It appears that there's a very high level of mask compliance with outsiders coming onto the school campus for extracurricular activities. Can you just talk about the importance of why it's important for me to wear a mask when I'm at the school?
Yeah, again, I think it's all, it's about keeping everybody safe. And I love Dr. Shackleton's statement. It's about keeping our neighbors safe. And so, quite honestly, as an administrator and a school administrator, our obligation extends, I think, past our students. It extends to our community and our parents and our grandparents. And we know that there are populations that come and watch our kids in activities that fall into that 55 year and older range. And we need to keep those people as safe as we do our own student bodies. So I've been very impressed with our community and their adherence to our guidelines as it relates to wearing masks. I will tell you, I traveled to quite a few activities as well, and that I don't walk in every gym and see the spectators mask the way we do here at Gothenburg. So kudos to I think, first of all, our kids have done a wonderful job with it. We remind them on occasion, but they've done a wonderful job. I think our parents have reinforced that. And then of course the community at large as well.
Great.
It's, the bottom line is I honestly believe we've got to keep masked up to keep our doors open and to keep our in-person learning thriving.
Yep. Great. Thank you, Dr. Rhodes. Gary, with the city, had a question come in, and I think we maybe touched on it a little bit as we maybe drew some of those comparisons to what's legal but not advisable. There's a question that came in about the city officials maybe should put some type of ordinance in place precluding large gatherings and so on and so forth. I don't think that's a direction that the city's going to go, but what we're trying to do is educate people on what good choices look like. And even though there may be a baseline precedent set in the DHMs or the directed health measures, how do you see the municipality of Gothenburg potentially playing a role in this?
I think from the very beginning, what we've tried to do is be a source of information and share as much information from meetings like this and other meetings we have with other municipalities across the state and nation. I think early on we decided that we were going to follow the governor's guidelines, and those being the highest rules of our state made a lot of sense to do that. So at this point in time, we're kind of in a role where there aren't really many rules from the governor, but we're still trying to be an informational source to tell people, let's try to make good choices here and do what's right for your neighbors, as we do in everything we do with the city. So not sure that we could pass an ordinance that would hold up in a court later on to mandate things. So we've taken the position that it's our job just to help people do the right thing at this point.
And I think if you see an activity occurring that may not be in the community's best interest, maybe approach those people involved with it under the sense of education. This seems like the whole COVID experience seems like a potential opportunity to be fairly judgy. And I don't know how to describe it any other way, but that really doesn't do us any good. If you see behavior that maybe your initial reaction is to maybe judge, maybe try to educate somebody in light of judge or to criticize. I think for the most part, all of us are very well intended. We're all trying to do the right thing. We all want good outcomes, and there may be a disconnect between information that they've been exposed to, and that may be influencing their behavior. So anybody that's on this meeting today, please take the time to educate others to maybe make better choices. Two Rivers, really appreciate you taking time to be with us today. I know there's extreme amount of demands on you guys' time. Dr. Menon, any closing comments for our group?
In general, no. Thank you so much, Nad, for a great meeting. Thank you so much for the discussion, really rich. I'd just like to add one extra point to the masking discussion that you talked about, and this is like all of our understanding is really evolving. But one of the things that that's been sort of like an opinion that's been shared by some other people outside, some researchers outside, that seems to be gathering steam now, seems to be that masking might be a sort of a rudimentary vaccine of sorts through a process that they call variolation. They think that the amount of virus material that you get through a mask might be a lot less than the viral load that you get if you're directly getting a direct blast, from someone else who's infected. And so in some ways, even if you're in the presence of a person who's COVID positive and they are not using a mask and you are, just by load of the lesser amount of virus particles that you get, it's possible that you might get a milder version of the disease that might actually work out to be in your favor rather than a really full-blown case with a very high viral load because you've ingested a lot of the droplets to begin with. Early stages yet, but there are studies that sort of that substantiate this claim by looking at actual viral loads in control groups that are masked and not masked, and they've found that overall at the population level, viral loads are lower when there's universal masking. So just to add that out there, but thank you so much. Have a great weekend.
Awesome. Thank you, Dr. Menon. Yeah, as a lover of science and data, it's fascinating to me. I love the expanded knowledge base the expansion of learning that has occurred in the last several months. As I said before, what we're going to learn in the coming months is it's really going to be fun to see our progress there. As we wrap up the meeting, just want to plant a seed in everybody's mind. It seems like almost every COVID conversation that I'm involved with, people want to get back to normal. And it seems like there's a heavy sense of nostalgia looking backwards. What I would encourage us to do as a group is don't hold so tightly onto the past that we forget to be optimistic about what today or what tomorrow looks like. The world has changed. We are in a different time. We're in a different place today than what we had been in the past. We're not going to go back to 2019. That's just not going to happen. The reality is we are in 2020. COVID is a reality for all of us. We are developing new social norms. There is a new sense of normal, but that doesn't mean we can't have hope and excitement for the future and how we achieve our goals and what we want to accomplish in the new set of circumstances that we find ourselves involved in. So please don't hold so tightly onto the past that you forget to have optimism and excitement about the future. Please take what you've learned today and share it with people that are in your social circles. A big thank you to the panelists for taking time out of your busy schedules to share this information with us. Thank you, Gothenburg.